Under eye wrinkles are one of the most common concerns I hear about in the office. Whether it's fine lines, crepey skin, or even deeper wrinkles, there are solutions that actually work. Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist, and today I'm going to walk you through the best ways to treat and prevent under eye wrinkles. Let's dive in. First, why do under eye wrinkles even happen? So there's a multitude of factors that contribute. The first is, you guessed it, aging and collagen loss. So as we age, collagen production slows down, leading to thinner skin and more visible wrinkles, especially in an area under the eye that moves quite a bit with your natural expression and also where the skin is naturally a little bit thinner anyway. The next reason is sun damage. So often people forget to put sunscreen right under the eye. Now there are some wonderful formulations that are gentle for that sensitive skin area, and it is so important to not only protect that under eye area with sunscreen daily, but also to wear sunglasses. UV rays break down collagen and contribute to accelerated aging changes on the skin. Next, repetitive facial expression, so squinting, smiling, and even rubbing your eyes if you suffer from allergies or itchy eyes can contribute to the worsening of those under eye wrinkles. So just be mindful, if your eyes are itchy, try not to rub, try to pat or use a cold compress, something where you're not constantly pulling and tugging at the skin. Now I didn't say not to smile, but certainly squinting can be prevented. So like I mentioned earlier, just wear your sunglasses if you're going to be somewhere bright and sunny. Try not to squint by protecting your eyes from the glare. And lastly, dehydration and lifestyle factors can accelerate those aging changes under the eyes. So lack of moisture, so not applying a moisturizing cream to the under eye area or being dehydrated can contribute, in addition to things like smoking, drinking, and not getting enough sleep. This can all accelerate those aging changes, especially under the eye. These can all make those under eye lines look way more prominent than they should, even if you're not quite there yet. So what can we do to help prevent the formation of these under eye wrinkles and also start the process of treating them? So you're going to want to look for products that have retinoid or retinol in them. There are a lot of wonderfully formulated eye creams that contain retinoids or retinol in them, which helps stimulate collagen production and smooth out those under eye lines over time. So using retinoids can accelerate the rate at which your cells turn over, again boosting collagen production, helping to brighten the area and smooth out any irregular texture changes. Now products with peptides and growth factors can also help strengthen and hydrate that delicate under eye skin. If that lid skin seems very dehydrated, look for ingredients like hyaluronic acid, ceramides, and caffeine, which actually can help plump and brighten that under eye area. I said it before and I'm going to say it again, sunscreen is your best bet for anti-aging, especially under the eyes. I mean, really everywhere, but under the eyes as well. Look for products specifically formulated for that delicate lid skin with SPF 30 or higher, typically those that have mineral ingredients like zinc oxide and titanium dioxide are going to be more gentle for that sensitive skin. So you're going to want to look for a broad spectrum sunscreen formulated for the under eye area or a mineral-based sunscreen. If it's a mineral-based sunscreen that's gentle enough for babies, it's probably gentle enough for your lid skin. Lastly, gentle massages and hydrating eye patches can help that under eye area. This is an area where we tend to get a lot of fluid accumulation. There are some key lymph vessels there that will help drain excess fluid. But if you do tend to accumulate fluid under the eye area, for example, if you have seasonal allergies regularly, a gentle massage, so moving inward to outward, so the inner corner of the eye to the outer corner, is going to help to move that fluid so that the area doesn't look so puffy. Now make sure you're not going back and forth. You really want to go in to out and stop and in to out again. There are also some really nice eye creams that contain a cooling tip where you can actually massage and cool the lid area at the same time. And lastly, if your home treatments are working but you want a little bit more, combining those at-home treatments with in-office treatments can really help you achieve your goals, especially when it comes to that delicate under eye skin area. In the office, we can do injectable treatments like Botox to soften the formation of those etched lines under the skin. So we can inject Botox right on the outer corner of the eye to help with the formation of crow's feet, and we can also inject Botox into this jelly roll area right here, which can be more pronounced in some people than others. But if when you smile you notice an extra crease right under the lower lid, that can also be treated with Botox. Now, fillers can be placed very strategically in that under eye area. If you have hollowing or loss of volume, or what we call a tear trough, fillers can be placed right along your lower lid to help replace that volume and also lead to a more smooth appearance of the skin under the eye. Procedures like laser resurfacing can really help address that crepey lid skin. In the office, we do both ablative and non-ablative procedures with lasers to help resurface that skin under the eye. And these procedures, again, are paired best with your at-home topical treatments and also with injectable neuromodulators like Botox, because once we get that lid skin really smooth, it's nice to prevent the reformation of those lines with something like Botox. Microneedling plus PRP is another great option for resurfacing. There's going to be less downtime. It's something that can be done every month or so, and it really helps to fortify that under eyelid skin area, boost collagen with minimal downtime. And lastly, chemical peels can really help with discoloration changes under the eye. So we do a lot of chemical peels in the office, again, combining with lasers and injectables to help with the discoloration. Now, if you have discoloration that might be due to vascular changes or dilated blood vessels under the eye, we can also do lasers to help collapse those vessels to get rid of that red or purple appearance, and then a chemical peel if indicated if there's more hyperpigmentation on top. So as you see, there's really no one-size-fits-all treatment approach to these under eye wrinkles or discoloration, but there are a lot of things in our toolbox that we can use as dermatologists and also that you can use at home to help prevent and treat this area. There's no one-size-fits-all approach to treating under eye wrinkles, but with the right skincare and treatment, you can absolutely improve their appearance. What's your go-to eye cream or under eye treatment? Let me know in the comments below. And don't forget to like, subscribe, and hit that bell for more dermatologist-approved skincare tips.